All right, perfect. Well, as I said, thank you so much for being here today. This is, I believe, week 6 of the Digital Opportunity Champions program. And today we're going to be talking about telehealth and HIPAA. So again, topic again, I'm really excited for. So to start out, again, we'll define our objectives. So the first objective is to describe what HIPAA is and why is it important for protecting patient privacy. We'll also work to understand how HIPAA keeps online doctor visits private and secure. We'll work to understand what rights patients have under HIPAA when they're using telehealth services. And we'll also share ways that you can keep your personal health information safe during virtual visits. So, what does HIPAA stand for? So, the full form of HIPAA is the Health Insurance Portability and Accountability Act. So, HIPAA is really a law that helps protect people's private health information. It makes sure that doctors, physicians, any sort of healthcare provider, and even staff are included in that. Hospitals and insurance companies keep your medical records safe and do not share any of that information without your explicit permission. It gives patients the right to see their medical records and ask for corrections if something is wrong. So I believe that was an additional after HIPAA was already in effect. They added that piece on as well, where you can have the ability to review your own medical records and ask them to correct things if there are things that are incorrect in there. It also ensures that your personal health information stays private and is only shared when it is absolutely necessary, like, for example, for your treatment, or if the law would require your healthcare provider or staff to share that information. So, without HIPAA, hospitals, doctors, and insurance companies could share or potentially misuse your private medical details. So, HIPAA really helps prevent identity theft, discrimination, and embarrassment by keeping medical details private and secure. So we have a quick video here. If you've ever read through the HIPAA policies, you'll know there's a lot of terminology in there. And so we thought it'd be good to kind of have this video to introduce you to all the different terminology and kind of decode a little bit of that HIPAA policy. So I'll go ahead and play the video. Please give me a thumbs up or let me know in the chat if you can hear and see the video that I'm playing.
We can hear it.
Okay, so that was a lot of information. They just kind of speed ran through all of that, all of those terms. So I'll pause here briefly in case anyone has any questions or anything about the video that we just watched. Anything? Thoughts? Anything?
What's a health clearinghouse?
What's a health clearinghouse? I
Yeah.
think some, and I may be wrong about this, but this is my understanding of it. I think some organizations, healthcare organizations, have their data managed by a separate entity that's like a health clearinghouse. So they probably do a lot of like the data analysis and things like that. So they're not like a healthcare center, but they would deal with like vast amounts of patient data, practically all of the health data from a healthcare system. So I think that's why they're not in the business associate category. I believe that's why they fall under like the covered entity category. Does that make sense?
It does. Thank you.
Yeah.
Mira, what was an
Mhm.
MSP? It was one of the first ones that they introduced as a business associate back a couple, like maybe 30 seconds.
Here, MSP. That is actually a great question. I'm not sure I even know what that is. I'm just gonna look it up. Oh, it's
Yeah,
a
there were
managed
actually
service
several.
provider. Gotcha. Okay.
What, I'm
So
sorry?
it's
Can you repeat
it's a
that?
managed service provider. So this would
Okay.
be like a third party company that does different tasks so they might do recruitment, they could do credentialing potentially, they can handle payroll. So it's essentially someone you might hire like a healthcare system or an organization might hire someone and outsource some of their administrative tasks. But again, in the course of some of those administrative tasks, that they may encounter PHI, which is probably why they're an example of a business associate. They can encounter PHI from the employees, right? If they're on the admin side, it's not just patient PHI, it's also your employees' PHI. If they're managing any of your health insurance or things like that, then they have to be HIPAA compliant. And if the business associate thing can be kind of confusing, because I think there's a lot of different categories that they showed. So if you're looking at this like an EHR provider, I think that one is self-explanatory. I mean, an EHR contains all of the medical information, right? Medical billing services, same thing. When you bill for medical services, you have like CPT codes. And basically you link like a patient's diagnosis to like what would be a covered code for like insurance billing purposes. And so obviously if you're handling the billing, you may come across diagnoses or things like that that are again private PHI information, private health information. A cloud storage provider, of course, cloud storage is just, like not physical services, storing your files elsewhere in a server. So again, if you're storing any of those files from a healthcare organization, could have protected health information. Actually, I think, funnily enough, so the Office of Rural Health, we have grantees. We have state designated rural health centers, which are our grantees. So those are clinics, typically primary care clinics across North Carolina. And we also have a network of rural hospitals. And so I think technically we are a business associate because we are required to be HIPAA compliant. Because when we administer grants, oftentimes there's reporting required to receive a grant. And so we have to on occasion, handle PHI. And so we are actually required to be HIPAA compliant, and we have a HIPAA compliance officer who monitors, and we have the incident processes and things like that as well. So it's the business associate can really be flexible. That really encompasses anyone other than the actual healthcare providers or the clearinghouses, if that makes sense. Anyone else who's working with a healthcare system or a clinic would be considered a business associate. And they have to be HIPAA compliant, even if they're not necessarily dealing with PHI every day. If there's a chance they come across it, then they need to be HIPAA compliant and trained in HIPAA policies. Other questions, thoughts? Okie doke. I'll send out the link to this video when I send out the recording as well, because I think it could be helpful. And I believe there's actually, as they mentioned at the end, there's actually a series of videos which might be helpful to you all to learn a bit more about HIPAA as well. All right, so getting into HIPAA and telehealth specifically and talking about, protecting patient information when we are doing, telehealth specifically. So secure technology, telehealth must use special, secure video calling platforms that protect information from hackers. So regular video calling apps like FaceTime or Zoom actually even are not secure enough. So during the COVID pandemic, actually, the government had passed some waivers regarding this. There were some waivers in effect that allowed certain, like typically non-allowable video calling platforms to be used. So I know personally, I was working in a primary care clinic, and so we often used Google Meets if our original platform, Doximity, which is encrypted, was not available. However, I don't believe those waivers are still in effect. So you need to use a secure, encrypted, compliant video calling or telehealth video conferencing platform when you are doing telehealth visits in order to protect the information. So again, data encryption, this can be a kind of confusing concept. So we really wanted to just break it down. Like, what does it really mean? So medical records and messages that are sent on these secure platforms, like your patient portal or a telehealth platform, they're encrypted, which means whatever text is sent is actually converted into an unreadable text. And this unreadable text can only be deciphered if a member of your healthcare team logs into the portal with a password. So what does that mean? So let's say I'm sitting at my house and I'm like, I have a healthcare question I want to send my provider. So I open up my patient portal, I log in, and I type up my message and I send that on through, right? Let's say I'm at a Starbucks or some kind of public Wi-Fi hotspot, right? And that means my Wi-Fi is not protected. Maybe people can view the data I'm sending through, my computer or my device. So let's say there's someone on that Wi-Fi network who's trying to access my information, right? And they catch that message as it's on its way to my doctor, and they try to read what is it that I sent. They will, when they download that message, it will be an unreadable text, right? It won't show them the actual message. That message would have been converted into some kind of, it's like a code almost. So when they download it, they will just get a bunch of unreadable text, and you can't decipher it. So when that text is being transmitted, it's being transmitted as unreadable text. When it gets to the inbox of your doctor, right, through the patient portal, once they receive that message, when they log into their patient portal, they can read the undeciphered message within the portal, right? But they'd have to log into the portal to be able to access that. Does that make sense? I know this is kind of a complicated concept, but basically the gist is when the message is being transmitted from your device to your physician's device, right? In between that time, the message is encrypted. So it's in a code that if anybody tried to access it or get it, they would not be able to read it. Any questions about that as a concept?
Sorry, Mira, just curious if there's different levels of encryption, right? I mean, is some
Yes.
more encrypted than others, less likely to be hacked? Are there tiers? How does that work exactly? If you don't mind taking a bit of a tangent for me.
Yeah, no, there are different levels of encryption. And so for example, like even technically some of your websites, like if you go onto your Gmail or email account and you look at the top, there's like a bar that has like the web address in it. On the left-hand side, there's a little lock button that comes up sometimes, and that indicates that that website or whatever you're on is encrypted and secured. So, for example, technically Gmail has a level of encryption, right? Or whatever email service you use typically will have a level of encryption there. So when you're sending an email, hopefully in the midst of someone trying to capture that before it gets to the intended recipient, it's undecipherable. But there are levels of encryption, and typically, again, patient portals, telehealth software will have the highest level of encryption. So there are actually standards that organizations have to adhere to. So I don't want to get into too much of the technicality, but as you say, there are different levels to it. And obviously, patient health information and the HIPAA actually puts into effect that you need to have the highest level of encryption possible. So there are technical standards that these softwares have to meet in order to be compliant, which is why sometimes even Zoom or Teams, for example, I'm not sure if Teams has so some of the software companies, when they put out this law, what they did is they developed two different versions of their software. So, for example, Teams, I'm not sure if they have it, but they could have a general use that anyone can download, right? For example, Zoom does have that, right? Zoom has a regular license that anyone can download off their website and use. And then sometimes they'll have one that's a paid version that has that higher level of encryption that's meant to be used for, work purposes or things like that. So I think Zoom actually does have some licenses, but again, I'm not sure if they meet that standard of needing to be encrypted. So for example, I know a lot of organizations use Doximity, which does meet that. That's like specifically a telehealth platform. That's what it was developed for. So like the average person can't just download Doximity and use it. And I think even my healthcare providers now use a different one, but typically they're not using Zoom, Teams, or the ones that we're familiar with. There are separate telehealth platforms now developed that have that highest level of encryption to protect your data. So I was long-winded, but I hope that answers your question.
Yeah, no, thank you very much. So you're saying that medical records have the highest level of encryption that's available? Okay,
Yes,
fantastic.
I think because again, HIPAA has standardized requirements for EHRs and patient portals and for telehealth software programs that you have to adhere to. So again, there were waivers in place during COVID specifically for telehealth platforms because they wanted to make telehealth more accessible. So there were waivers in place where you could use other softwares because again, they acknowledged, I think, during that time that healthcare systems or little private clinics may not have the infrastructure or the funds available to purchase a highly encrypted software. So again, if your patient consented to it, you could use some of those lower encryption versions like Google Meets, for example. But now I don't believe those waivers are in place because again, we're not in a pandemic situation. But typically, yes, HIPAA does have they have technical standards that EHRs, patient portals, and the telehealth softwares have to meet in order to be compliant with HIPAA.
Thank you. I appreciate you.
Yeah, absolutely. Oh, Cynthia in the chat said Zoom has a separate telehealth for small. Oh, good. Okay. So I wasn't sure. I feel like they did, but I was like, I'm not sure that they do. But that's awesome to know that they've launched this because I think that some of these like Zoom, Teams, and all are more accessible to the general public. So if they do have that available, I think that's great. But I think offices need to get around to using it maybe. And I don't know what the cost is associated with it, but I'd be interested to find out. Thanks for sharing that. Oh, you doke. So then we're talking about patient portals, health portals. So again, access to information in health portals and virtual appointments is of course limited to members of the healthcare team. And there are actually pretty stringent laws about this. So for example, when I worked at the clinic that I worked at, there were several healthcare teams, right? So teams are led by a different physician or healthcare provider, and then they have their own staff. So even within teams, different teams, typically providers or healthcare staff are not supposed to speak about the patients that their provider is seeing or that they're seeing with each other unless for some reason that healthcare provider is also going to provide some kind of care. So typically if your doctor sees you as a patient, they're not really supposed to discuss that with other people, right? And the only exception to that, I think, would be if you saw a different provider at that clinic and then they came to your primary care physician and let them know, like, hey, I saw your patient. But even this applies to staff as well. I just want to emphasize that because I think a lot of it, when we think about HIPAA, we think about, yeah, our primary care provider or our healthcare providers. But it also does apply to staff. So me as a staff member, I had to be trained in HIPAA and I had to be compliant with that as well. So I was also not allowed. No one within the healthcare entity is really allowed to discuss it other than the immediate members of your healthcare team that are providing you care. And then this is a really, really big thing with HIPAA. So patients have the right to know how their information is used and who can or cannot see it. I think this is really important because I think Of course, patients had rights before, but there was no law or policy enshrining their rights, right? So HIPAA, I think, is really monumental for that reason as well. So at any time, you can go to your healthcare provider and say, I'd like to see my entire medical record. And of course, if you have a patient portal, you do have access to that. But you can actually request, the patient portal shows you, some patient portals don't show you like your provider's notes that they take during the visit, right? They might only show you your lab results or test results or just whatever. Like sometimes portals have a patient facing side, right? Where they only show you the information that they feel is relevant to you. But you can actually request to see whatever the provider's notes as well. So that I just would like to make people aware of, because if you feel like maybe your provider isn't documenting your concerns, you can actually ask them, to show you their side of the notes as well. I believe there's some paperwork you'd have to fill out. But I think this is really important because, again, in the past, right, there was no requirement for healthcare organizations to have to provide this information to their patients. So I think, again, it's really monumental that this makes that a requirement, right? And it really, I think it's empowering for patients to have access to their health records. So this is also really important. So obviously, there are people who may be not following the rules or not following the specific standards set by HIPAA, but failure to follow HIPAA rules will result in legal action, including but not limited to paying a fine. And actually paying a fine, I think, would probably be on the lower end of actions that can be taken. So I will say that if you haven't read through the HIPAA policy, they have a they have a very lengthy list of what actions look like, and it's tiered according to like the severity of your violation, right? So again, I think it's good for everyone to be aware of that, because if you do feel like a breach has occurred in some way, or someone that you didn't want to have access to your information, or someone unlawfully took access to your information, I think people need to know what their rights are, especially via telehealth, right? Because again, when you're agreeing, so many patients are hesitant to use telehealth because they're worried about this. They're worried about their information being stolen or, being scammed, or someone, again, unlawfully or not against their will having access to their information. I think it's really important for patients to understand HIPAA as well, so that they know what steps will be taken to protect their information and what the consequences are if these organizations fail to protect their information. So they've again laid out very, very specific, consequences to these infractions. So I think that's also really important, because I often think sometimes, concern about the consequences can make an organization be very strict about this, right? So it's really important. So talking about patient rights, again, I said that HIPAA really did a great job of enshrining patient rights to their information. So when using telehealth, what are the rights that patients have, right? So they have a right to their personal health information being kept private, even during online physician visits. So typically, I think we've seen this a couple sessions ago. We watched a video where they did a walkthrough of a telehealth visit, right? And if you noticed, I don't know if you remember, but the physician actually was in a patient room with their laptop on the counter doing the telehealth visit. And you might wonder, like, technically they could be anywhere, right? They could be in their office, they could be, in the hallway. But again, it's really important that they are in that patient room, because that's one of the only places where no one will enter the room without knocking on the door or making sure, right, who's in there. If they're in their office, one of their colleagues might come in there, right, unannounced or something like that. The patient rooms sometimes are the only private protected rooms within a healthcare clinic, right? So I think that's really important. Again, the physicians do need to protect the patient information the same way they would if a patient was actually there in person. Patients have the right to secure video calls, messaging, and online portals provided by their doctor. So again, it's really important that the softwares or the online portals that healthcare systems are using meet those technical standards that are defined by HIPAA in order to protect patient information. Patients have a right to see their own medical records, request copies, and see what information a physician has about them. Again, sometimes, patients transfer in from different states or they move across healthcare systems. And they might want to see what another physician said about them, what kind of records were sent over, right? But they have a right to see all of that information and access that information, which I think also is an accountability measure for the healthcare staff and the providers, right? Because if a patient is able to see their records, I think it adds an extra layer of responsibility that you have when you're documenting, that you're documenting accurately. Patient have a right to request that mistakes be corrected in medical records. So this does happen. Sometimes, providers do accidentally document the incorrect diagnoses or the wrong code or something like that. And so if a patient reviews their medical records and they find a mistake, they have the right to ask that to be corrected. Because sometimes those kinds of mistakes can have unintended repercussions as well. One example I can think of is, with sometimes life insurance policies, they request your access to your medical records, and sometimes there are denials of claims based on what was documented in your medical record. So that's just one example I can think of where a mistake in your medical record might have an impact somewhere outside of your health, right, on your life. So I think that's, again, really important that was enshrined in HIPAA. Patients also have the right to decide who their health information is shared with. So we've talked about this, vaguely before, but again, a patient can designate a family member or a trusted individual to have access to their medical records, right? They can fill out that paperwork and they can say, I want this person to have access. I think that's really important, especially, in older patients, who may have caregivers. I think it can be really important for the caregivers to have full access to their medical record. At the same time, it is the patient's decision and they can decide who their health information is shared with. And I think that's really important that the patient maintains that autonomy and the ability to decide, who can have access to their information. And I think that also, again, is a measure of safety, right? I hope patients feel safer using telehealth or whatever digital health technology, knowing that they still maintain the right to decide who their information is shared with. So I think that's important. Finally, patients also have the right to be notified if private health information is ever exposed in a security breach. So again, I think that's also really important for patients to know that in the unfortunate event that any of their private health information is exposed, HIPAA again has really, really stringent guidelines. I mean, they literally have it step by step guidelines that they give to the organizations of what needs to happen. And I believe if it's not the first step, it's like one of the first steps is immediately notifying the patient in writing that this has happened. So I think when we talk to patients and we're trying to build that comfort level with these new technologies that they might be worried about, of course, we want to emphasize that it's safe, secure, right? There are standards in place, but also let them know that in case that does happen, right, there are rules and regulations for you needing to be informed. So your healthcare organization will keep you informed. They're legally obligated to do so if anything were to happen, so that you can immediately take whatever steps you need to take to protect your information or secure your information again. So that might be, for example, let's say patient portal is hacked into, right? This happens. I think there have been several examples in the past couple of years. There have been massive attacks on malware attacks on healthcare insurance organizations. I think United Healthcare had a breach as well. So in those types of breaches, right, your healthcare organization might reach out to you and say, hey, we've had a breach of our security, and here's some steps you could take. So steps might include, again, changing your password, right? Making your password more complicated, but just changing it from whatever it was, if that was included in the breach. It might be setting up two-factor authentication, which we'll get into a little bit later. But they might be able to give you a couple of steps that you could take to secure any information that may have occurred during the breach. And I believe they also have to tell you what types of information was affected by any breach. So these are all, again, really important factors, I think, when it comes to, again, talking to patients and getting them more comfortable using these technologies. I think having this information about how their information is protected can be really important and might help build some of, again, that comfort if they're aware of the policies and procedures that are in place. I know that was a lot, so I guess I'll pause here for a second. I see a question in the chat. Does HIPAA cover billing information? Two recent data breaches impacting health systems in Eastern North Carolina last year through patient portals, with billing information being the focus. The repercussions are still impacting patients. So to answer your question, I believe the answer to that is yes, because oftentimes, again, healthcare billing information can contain PHI. So again, for example, when healthcare providers bill, right? Again, I don't know. I think the billing process can be kind of convoluted. So I don't know how many of you are familiar with this. You may already know about this, but typically for insurance claims to be processed, whatever code they're billing for, so whatever treatment they've provided you or that they bill for, they have to attach that code to a diagnosis typically that's already in your chart. So oftentimes billing information does have your private health information attached to it. It's got that diagnosis code. So that's again private health information. So to answer your question, yes, I do believe that's included, and not just for the healthcare organization, but in the video we watched, medical billing companies were actually included as a business associate. So not just the healthcare system has to protect your billing information, but any business associates they have would also be entities that need to be HIPAA compliant as well with that data. So yeah, it can be, billing information can definitely be one of the things affected by breaches. Absolutely. Other questions or thoughts about anything?
Mira, I think that this is so valuable to know when working with our senior population, with the
Mhm.
HS Access Project especially, because we say, oh, it's safe, don't worry. But this really lays it out like there are really strict consequences if these sorts of breaches happen. And I think understanding that and relaying that to our seniors, especially in the rural communities, would really help take some of the fear away. So thank you for being so descriptive in the rights that patients have. That's wonderful.
Yeah, absolutely. And I agree with you. I think again, right? Like we do say, yeah, it's safe, don't worry about it. It's encrypted, right? It's secure. Well, what does that mean, right? Like again, I think sometimes a lot of the health education that we do, we come at it from, our level of understanding and we may know what those words mean. But even like when Courtney and I were writing this material, when I said, "Oh yeah, it's encrypted," I had to look up how to explain that. Like because I know what it means, but when you're trying to explain something to someone else, like I think it's really important to break it down again to the base concept, right? What does encrypted even mean? How do I know my information is protected if I don't even understand that concept? So, yeah, absolutely. I think this is really important. Again, as we're trying to make people comfortable with digital health technologies as well, I think it's really important for them to not just know that their information is secure and protected, but again, what rights do you have? And then what are the consequences if something like this were to happen? I think it could help them feel more comfortable. So yeah, absolutely. Other thoughts or questions? Okie doke.
I have a question,
Oh,
and I
go
don't
ahead.
know if
Yeah.
this is related. Sorry, I have stood under some books here, but
You're good.
um, so there was an application that was done for like life insurance, and I got like this denial saying that there was medication on my medication somewhere in some list that I can't even imagine what it was because I was under no medication. Um, How does HIPAA help with that? And who was informing the insurance company? And, you know, I thought I'm going to fight this, and then I didn't. That never
Yeah.
has come up again. That was in New York. So my one question is, does HIPAA change states? And I don't know if you covered that, but and the other thing is like, how could that have happened? And that wasn't, that was pretty recent. HIPAA was definitely on.
Yeah. So I yes, this is again a common thing. I actually mentioned this, right? Like sometimes with life insurance, that does happen. We did see that with some of our patients as well. Um, I I think HIPAA doesn't change from state to state because this is the federal policy, so everyone is bound by this. I believe the policies don't change from state to state, but I will double check on that, I suppose, but I'm pretty sure it's identical from state to state. The requirements don't change. Um, when it comes to life insurance companies, this is one part that I'm not certain of. I'm not sure if it's legally mandated for healthcare organizations to provide that information. It's possible that, they may ask patients to sign a release of their information so that they can access that. That's one part I'm not certain about, is how they get access. But those are the only two ways where it would have to be legally mandated, or they would have to get a release form from the patient, right? Because again, according to HIPAA, if you are not legally, if you are not one of the entities that healthcare organizations are legally required to provide information to, they have to obtain a release from you, right? They have to
Or
get your
somehow,
permission.
somewhere, I probably signed something. Who
It's
knows when,
possible,
where, or what.
or they're a covered entity, but I'm not sure about that. I have to be honest. I'm not sure if they're legally required to give it. That may be the case. But those are the only two ways I can imagine they obtained access to your healthcare information. But I will say, in that instance, you are able to ask them, like, what is the entity from which you got this information? Because I think they have, as your insurance company, maybe they have access to like where you've been billed or something like that. I don't know, but basically you are allowed to ask them like which is the healthcare organization that gave you this information, and then go to that organization and ask for your records, right? And your full medical record. They might say, oh, you have the patient portal, but actually sometimes, again, that shows patient facing information. It doesn't always show you like what the provider wrote in their note or documented specifically. So you are allowed to go into the physician office and say, I would like my full medical record, right? And there's, again, a process for that. And then you can review that and see like where was it incorrectly documented, and ask to have that corrected and send that over to the insurance company. But again, sometimes I think it is a lengthy process. So it can be a little challenging, but you do have that right to be able to do that. But again, it happens where providers document incorrectly. And imagine that, I'm thinking like prior to HIPAA, where you didn't necessarily, it's not like they could have kept you from accessing it, I suppose, but you didn't explicitly have that right. If a provider did document something incorrectly, how are they to be held accountable, right? That's what I'm thinking about. Like, typically only the patient knows, right? I've never taken that medication. Why is that on there, right? Or I've never seen this doctor, or I've never had this procedure. So yeah, I think it's great that those rights are enshrined, but I think there's still a lot of work to be done for patients to know what rights they have and what information they have access to, right? Because I think that's where it gets a little convoluted sometimes. Yeah.
Definitely. Thank you.
Yeah, absolutely. I'm upset that you've went through that situation in the first place. That's distressing to hear. And again, I think it perfectly highlights why there needs to be more education, again, on the patient side, to understand what their rights are under HIPAA, for sure. So this was going to be a discussion point anyway, so I guess I'll just throw this out. But I guess we wanted to pause for a second and just throw it out to you all. But the question is, how can we keep personal health information safe during telehealth visits? Well, we're going to go through it, but does anybody have any thoughts about this specifically? Any ideas about how we might go about doing this?
Well, we talked about this, I think yesterday, Mira. We don't need to provide social security numbers unless specifically asked. Just
Yep.
keep that close to the chest as much as you can.
Yeah, absolutely. Understanding what information you actually do need to provide to your physician, under like the demographic information. Yeah, absolutely. Other thoughts? Well, we're going to go through it. So we'll just go through it step by step. Oops. So the first would be using a private space, right? We've talked about this again throughout. This comes up, but finding a quiet and private place for the visit so others cannot overhear the conversation. And this is both for the patient and also for the healthcare provider. Again, because the healthcare provider needs to, within the clinic, find a safe, secure space, even though they're doing the visit right online and the patient's not there physically present in person, they still need to find a private space so that they cannot be overheard, right? That's really important for them to protect your information. Additionally, using secure internet. So avoid using public Wi-Fi. Instead use a secure password protected internet connection. So again, I think I gave this an example, right, when I was talking about encryption, but often public Wi-Fi hotspots are not encrypted. So what does that mean? Basically, like when you have your own Wi-Fi connection in your home, right? Typically, you would have a password in order to be able to access that, right? Because you don't want anybody, in any other home to be able to use your Wi-Fi. And typically that's for like cost purposes, but it also does protect your private data, right? So again, if a public Wi-Fi hotspot is not protected, hackers can technically hack into there, malware can hack into that and access whatever information you're transmitting over that network, right? If that was your patient portal, they potentially could hack into that as well. So it's really, really important to use a secure internet connection when you're doing anything like accessing a patient portal or anything that might have your private health information, right? I think that's really important. Okay. Trying to go. So these are things you can kind of continue to do. So patients can check your doctor's platform. You can make sure the doctor is using a secure and HIPAA compliant telehealth app. These are just questions I think you would ask the physician office prior to having a telehealth visit. What is the platform that you use, and is it secure, and is it HIPAA compliant, right? I think that's really important to ask. Keep your own devices secure. So again, using strong passwords and enabling security features like two-factor authentication can be really helpful. Two-factor authentication actually has been a really big milestone, I think, in security practices. It can be kind of annoying. I mean, we have it on our, on our laptops from the Office of Rural Health, and sometimes I'm like, oh my gosh, like I have to do this every time. But the fact is, it really does help protect. The password is one layer of protection, and then again, the two-factor authentication is that second factor. Again, can be really helpful, right? Because you're using a separate device maybe to provide that authentication. So just make sure that it's really you, right? And that no one else is trying to access your information. So logging out after the visit, this is something I think patients should be reminded of. You should always log out of your telehealth app or patient portal after the session to prevent unauthorized access. So again, that could be someone outside of you. It could also be a family member, someone that you know that you just don't want to have access to that information, right? So sometimes I think a lot of the apps now have the automatic log out where if you're inactive for a certain period of time, they'll just log you out, again, to protect your information. But it's always just good practice to make sure that you go ahead and log out right after you're done, again, to protect your information. It's also really important to be careful with emails and messages, right? So it's important not to share personal health information through email or text messages unless you're using a secure patient portal. So again, I talked about this briefly before, but sometimes your email portals are encrypted to a certain level. But again, patient portals and anything that's dealing with private health information that your healthcare clinic or hospital is offering to you have to be highly, highly encrypted, more encrypted than anything that we are using on our in our daily lives. So I think it's really important to make sure that you're going through that portal if you have access to that, to make sure that your information is highly protected, right? So I think that's important. Updating software regularly. So this is another thing I think falls into the digital skills kind of realm of things, but keeping whatever device you're using, whether it be a laptop or your phone, smartphone, keeping that device's operating system, apps, and antivirus software updated protects against hackers, right? Sometimes this can even be if you're using an app for telehealth purposes or you have a patient portal app, they oftentimes, if they discover that there's some kind of breach or security issue, they send out an update, right, to that app or to that portal. And so if you don't update the app, then your information now is not as protected as it could be. So I think it's really important to let people know, like if you're using an app, especially keeping that app updated, or just keeping, again, your general devices system updated, your smartphone updates, your laptop updates. It's really important to run those to keep, again, your devices as secure as possible to protect your information. So that pretty much concludes all of the content for today. So I'll throw these discussion questions out there, but we can also just talk about anything else you want to talk about. So really what we want to encourage you all to think about is what can you do to assist others in understanding their rights under HIPAA, and in whatever role you are currently in, what are the ways in which you can facilitate compliance with HIPAA standards? What, maybe you're considering implementing a telehealth program or some kind of telehealth initiative. And so I guess how does that fall into the context of HIPAA compliance? But we can also just talk about anything else that was discussed today. I think there was a question in the chat actually to start with. So Cynthia asks, what are the implications for nursing homes, long-term care, and dementia care patients? Does the North Carolina Nursing Home Resident Bill of Rights supplement HIPAA? How do you ensure privacy with telehealth in these institutions? That's a great question. So to start with, I do believe that nursing homes, long-term care, dementia care facilities, again, have to be HIPAA compliant because oftentimes they are getting records from your healthcare institution, right? Especially if you were just coming out of a hospitalization, they oftentimes get those hospital records. And then they also sometimes are collecting some of your health information, right? So some of these nursing homes, long-term care facilities may have medical staff on site that are providing some sort of care, drawing blood, or just even collecting vitals, right? Your blood pressure, et cetera, temperature. And so that is, again, PHIs that has to be protected. So they would, I think they fall under like the healthcare side of things where they need to be HIPAA compliant. They could also be a business associate depending on, again, the level of healthcare information that they have, the PHI that they're generating. But regardless, they are covered entities under HIPAA. Does the NC Nursing Home Resident Bill of Rights supplement HIPAA? I'm not familiar with specifically what's in the North Carolina Nursing Home Resident Bill of Rights. However, HIPAA is I believe since it's federal policy, like that is the baseline. And then, yeah, any additional policy supplements that, but cannot supersede it, I believe. Oh, thank you for sharing that. I will take a look at that. Human services. Yeah, so I'm looking at it now, and it does seem like this is complements HIPAA essentially, because some of the things that are mentioned in here are also explicitly stated in under HIPAA as well. So, for example, number 6 says to have his or her personal and medical records kept confidential and not disclosed without the written consent of the individual or guardian, whose consent shall specify to whom the disclosure may be made. So again, that is pretty much how HIPAA goes. I believe if there were a conflict, which I don't think there would be because this seems like it's a DHHS policy, so it likely is in complement to HIPAA, but HIPAA would be like the first policy to follow, and then additionally there would be the complementing policies, if that makes sense.
One of the things with the nursing home and other care facilities is as I think about, being, visiting those types of facilities, is privacy.
Yes.
Doors are open, staff might have to facilitate something. How do you, it's what, as Arsenio Hall used to say, it's one of those things that make me say,
Yeah.
Yeah. And, because I see a lot of ways where it would be difficult to apply the HIPAA standards in those facilities.
Yeah, absolutely. And it can be a challenge for sure. I know exactly what you're talking about because my grandfather was actually in one of those facilities after one of his hospitalizations. And so, yeah, you're absolutely right. There's just so much going on in these facilities. They have so many patients. They have a pretty high patient load. And so I think sometimes it does become a little dicey situation where like you say, doors are open and people are talking about it. Physicians or care staff are moving through, rooms. I think, again, it's really important to emphasize, like, I think there's two sides to this where part of me, wants to say, I think those staff probably need a little more training and they need to be emphasize the importance of protecting patient health information. But I think there's another side of it too, where if patients are more aware of what their rights are, I think you can kind of demand better, right, from the staff that you're working with. So, for example, you can say, I'd like the door to be closed, please, when medical staff are in here, right? And you're providing some sort of treatment. And so I think there's kind of two ends to this where we can kind of address this concern from both ends. I do think staff could use a little more training, but I also think if patients are more aware of what their rights are, and patients should be encouraged to ask for these things, right? And just emphasize to them, this is enshrined. These are your rights. You have the right to do these things and ask for these things. And so you should be asking for them because it is important that you protect your health information as well, right? So I don't know if that explains it, but I think those are the two facets that we need to address, if that makes sense.
Well, I do know since there are two ombudsmen just down the hall from me.
Okay.
The two for our region, and one of the things they talk about is that patients often complain about a lack of privacy, even though it's guaranteed to them in their Bill of Rights. And part of it's just necessity, given the situation. But again, part of it, a lot of it is not inadequate training and inadequate the care providers in nursing homes are not the best paid people in the world. And they're strained and pushed to the limit a lot. So they kind of shortcut things, and that's to be expected to a certain degree, as long as it stays HIPAA compliant. And that's kind of because I can see questions in, like caregiver meetings and things that we do come up where they want to understand that they're caring for a patient or a dementia patient who's in care. And how do you do the follow-up visit with the neurologist when you can't get them there? You do a telehealth visit in the facility, and staff comes in, they do this, they do that, because they have a schedule, they got to keep that schedule. So yeah, it's just something to think about in terms of,
Yeah, absolutely. Yeah. And I think you're absolutely right. When we're talking about, HIPAA, partly it's important to acknowledge what challenges there might be in adhering to these standards, right? And part of that is, yes, if you've got like overworked staff who have a really, really high patient load and they're just moving from room to room, I can imagine that it gets a little complicated and sometimes they may like lapse, right, in a sense. But I think again, it is important, and the staff do need to have that training that this is the most vital, important thing you could do, right? Like, is protect the patient's information. And so that's got to be like top of mind all the time. At least the clinic that I worked at, like, as long as I worked at the clinic, that was like number one. I was like, how do I protect the patient information? Everything else comes after that, right? So like at the top of my mind every day when I went in to do my job was how am I going to protect the patient's information today? Make sure that I'm not, discussing patients like in an open area. But oftentimes, like in a clinic, like the clinic I worked at was open space, right? Like you've got the private patient rooms, but where the staff are congregating is all like opened out. And so I think it's really important, like, again, to maintain like distance between the healthcare teams, and for staff to know like who, even within staff themselves, like you're not supposed to discuss patients unless that staff member is directly working with that patient. So but there are challenges that are there. But I think we've got to think again hard about how to mitigate those challenges, right? Because I think emphasizing that HIPAA is like really like you have to protect patient information because it's not your health information to give out, right? So I think emphasizing that's probably the first step. But again, there's a lot of like, again, as with everything related to telehealth, it's really, again, complex. And I think there's a lot of like barriers and challenges that come into play with this as well, making sure you're enforcing this and following this for sure.
So could this program like be used in kind of like refresher course for staff and providers?
Yeah, I think you could. And we are, again, we're talking with AHAC and some other folks to try and figure out if we can put something like this course together, that could be hosted maybe on their website or somewhere online, as sort of a, refresher or introductory kind of course, I think it could be useful. I mean, the feedback we've gotten from you all has been really great. So we're feeling like maybe it could be a good, useful resource for people across the state for sure.
Okay, thanks.
Yeah, absolutely. I know we're coming up on time, but any other questions about anything that was presented today or just HIPAA in general? Well, if not, I'm going to hang out for a few more minutes, but Microsoft Forms has been down for me today, so hopefully it'll come back up. But I'm going to email out the link to the knowledge check for today. Again, quick, 3 questions, going to be pretty simple. But apologies for not having that already here today. The link is down for me, so I can't access it. But I will email that out shortly, hopefully if Microsoft Forms has come back up. But thank you all for another great session today, and I look forward to seeing you all next week.
Thank you, Vera.
Thank you
That
so
was
much,
lovely.
everybody.
Bye-bye.
Thanks,
Y'all have
y'all.
a good weekend.
Bye-bye.
You as well.